So Tori, if you'll start the recording.
Started.
Thank you. So tonight you're going to hear from your Boulder County Public Health Child Health Promotion Team that you've probably all been in close contact with. And we are on the screen. We have our lead, what we're calling mitigation specialist, Sarah Scully, our fearless leader, Kara Kaiser, myself, I'm Jane Wilkinson, and Tori Lee. We'll each go through different aspects of tonight's guidance and the use of these tools. And we have an epidemiologist support person who we go to ask all of our specific questions, Elena. And she's going to be answering along with our help at the end of this. And because it's a big group and we want to make sure we get through all of these tools, we're going to ask you to hold your questions and put them in chat. And then Tori and I will work through those and categorize them. So at the end, we'll go through all of your questions and we'll actually make a handout so we can keep them for future use. So we won't be able to stop and answer questions in order to get through the tools. And as we get started, I will mute everyone. So if you, and if you do, I think most of you know how to unmute if you need to, but I'm going to mute everyone. And Tori is going to start us off with the at-home symptom tool. So Tori, take it over. Thank you.
All right. Thank you, Jane. And thank you everyone for being here tonight with us. So the first tool we're going to review tonight is the at-home COVID symptom screening tool for parents and staff. And this is a checklist. It's a really great communication tool to send home with families and have so that they have a checklist they can look at to determine when to keep their child at home. And then staff can also use this tool to determine whether they need to stay at home. And so you'll see the list here, the checklist of symptom screeners. So feeling feverish, having chills or a temperature of 100.4 or higher, a new or unexplained persistent cough, shortness of breath, difficulty breathing, loss of taste or smell, fatigue, muscle aches, headache, sore throat, nausea or vomiting, diarrhea, runny nose or congestion. And so this symptom screen refers only to new symptoms or a change in usual symptoms. And students or staff should not be kept home for usual symptoms they experience due to a chronic condition unless they're worse than usual.
Thank you, Tori. And I want to mention that I listed the link in chat for this tool. And as we go along, I'll put each of the links in chat. They were also sent in the invitations and many other places, but you can copy it from chat if you need it now. Thank you, Tori.
Thanks.
Turn it over to Sarah. She's going to be talking about how children and staff that feels or appears unwell after arriving at school.
Hi, everybody, and thank you so much for joining us today. We really appreciate you taking time out of your incredibly busy day today to join us. So I'm going to be talking about COVID-19 child staff feels or appears unwell after arriving at school. Okay, so these people made it through that initial health screening in the morning, either a staff or a child. They seemed fine. They didn't report any symptoms. They didn't report being exposed to COVID-19, so they were allowed to come into class for the day. So just wanted to cover that stop sign at the top, just as a reminder, if anyone is experiencing difficulty breathing, chest pain, new confusion, difficulty concentrating, bluish lips or face, you need to call 911 immediately. Okay, so a staff or a child appears ill. first thing you're going to do is assess for any COVID-like symptoms. And there's a nice list right there. One change on this tool from the previous version of this tool is that a critical symptom has been pulled out, and that critical symptom is loss of taste or smell. And this is considered a critical symptom because it is highly correlated with someone having COVID-19. Then you can see your major symptoms that Tori mentioned, many of these in that last sheet, the feeling feverish, chills, temperature of 100.4 or greater, new or worsening cough, shortness of breath or difficulty breathing. And then our minor symptoms, which we know you see a tremendous amount of, especially in children. This is the sore throat, runny nose or congestion, muscle or body aches, headache, fatigue, nausea, vomiting, or diarrhea, okay? So the next step then is to ask, does this person have any loss of taste or smell of any duration, okay? It can be, you know, a day or 2 days or half a day. It's of any duration, and it's not the loss of taste or smell that is normally associated with that loss that you might sometimes find with someone who's congested. So this is more of a profound and complete loss of sense, loss of taste or smell of any duration. Now, if someone has this, because it's such a critical symptom and so much associated and so sensitive to being connected with COVID-19, we are immediately going to go follow that yes all the way down, and you're going to see that this student or staff, if they can put a mask on them, if they can wear it safely, you're going to arrange for them to go home. If they're a child or the staff will need to go home. You're going to put them in an isolated area somewhere that you've reserved for ill people, away from others. And then when they go home, they should contact their healthcare provider and ask to get a COVID-19 PCR test, okay? And then later, we're going to figure out when we can bring these people home. But I will just give you a sneak peek on this one. For someone with this critical symptom, they will be required to do home isolation for 10 days following symptom onset and 24 hours fever-free without the use of fever-reducing medicines, just because of how the critical nature of this symptom. Okay. So say this person does not have any new loss of taste or smell of any duration. You're going to answer no. Go to the next box. Does this person have any of the major or minor symptoms listed above? And it can just be one symptom. One symptom is all it takes. And you're going to, determine what the symptom is and if it's a major or minor symptom. Okay. So say you answer no, they don't have any of those major or minor symptoms. So they can follow the routine illness care. You follow your regular health policy, and they can return to class if appropriate. And you would alert the teacher to monitor this student or staff with heightened awareness, but they do not have to be excluded from school at that time. But if they answer yes, that they have, and you've determined that yes, they have a major or a minor symptom, you're going to ask this next question, which is, are all symptoms that this person has experienced consistent with symptoms of an existing chronic condition that they may have? Is this a regular symptom that they experience on a regular basis due to their chronic illness or just their baseline? Okay, so if we determine that yes, this is something that they experience all the time and this is not out of the ordinary, they will follow that. You will follow that line, yes, and they can go back to the classroom and be monitored. However, if you answer no, this is different. This is different than what a child normally or a staff normally experiences. This is new. It's not part of their baseline. It's not part of what they experience with their chronic condition. Then you are going to see if they can wear a mask safely. If so, ask them to wear one, arrange for them to go home, separate them from others until they can be picked up or leave. And then you're going to recommend that they see a healthcare provider and ask for a COVID-19 PCR test. Okay, and then the next two slides are really just larger representations of the top of the chart and the bottom of the chart. So I think, Jane, we can probably not spend any time on these because I pretty much covered everything on this chart.
Turn it over to Kara Kaiser for Return to Learn.
Good evening, everybody. Thank you so much for being here. So I am going to go over the return to care or return to learn guidance. And one of the new things with this new guidance is there are now 3 return to learn documents. There is when we're in the, and what you would do is look at that dial that's up in the upper left corner of the document, and that will, the arrow will show which guidance this is referring to. There is the Protect Our Neighbors, which is the R1 guidance. There's the Safer at Home level 1 and 2 guidance, and then there's the Safer at Home level 2. Let me see. Sorry, level 3, and that's the R3. And just to emphasize, we in Boulder County currently are in Safer at Home level 2. And Jane is showing with her cursor up there that that's where we are at.
And if I can just add, Kara, that I've put in chat, if people have access, each of these tools as you went through them. So you can pull them up and look at them closer if you haven't already done so.
Thank you, Jane.
So, yeah.
All right, so we are at the Safer at Home 2. So we're going to use, we've been referring it to as the R2 guidance. And I just want to back up real quick, as Sarah explained about, assessing a child once they're in care if they're sick and need to go home. One of the important things to remember is that when you send a child or staff home is to document that information on your illness log so that you have a record of it. And so that when the parent calls up and says, hey, we're ready, can Johnny come back to school, you will then go to this document and be able to reference as to when they left the school. So one of the things I do want to make sure, like the stop sign at the top, is that this tool is not intended for cases or close contact of COVID-19. So if somebody has already been diagnosed with COVID-19 or is in quarantine because they have an exposure, you will not use this to allow them to come back to care. They will be in quarantine or isolation, and there's no way to get out of quarantine or isolation, even with a negative COVID test. So to start off, as Sarah's chart explained, the first symptom they're going to look for is did the individual have loss of taste or smell of any duration. If the answer is yes, you go straight down to home isolation for 10 days following the symptom onset and 24 hours fever-free without the use of fever-reducing medications. There's no way to test out of that or get an alternate diagnosis. If they have that symptom, they're in home isolation. If the answer is no, then we're going to go over to have symptoms resolved within 24 hours of symptom onset. So that would be questions you'd be asking the staff or the parent is, how long did these symptoms last? If they were less than 24 hours from symptom onset,
Then you follow it down on the right or the left-hand side, and then you go to return to school following the illness well, let me back up. The symptoms so if they've resolved within 24 hours, they can return to school once those symptoms have stayed resolved an additional 24 hours. So that will be a total of 48 hours. And then from there, you follow your regular center illness policy. And I know some facilities have chosen to have a longer exclusion time, but the important thing is these symptoms have to stay resolved for at least 24 hours. So the parent says, no, the symptoms lasted, longer than 24 hours. So we follow the no over to, did the person have minor symptoms only? And did the symptoms resolve in 48 hours? And can the person wear a mask safely? So what's really important about this box is we are now distinguishing the type of symptom, is minor versus major. So if it was a minor symptom only, the symptoms resolved in 48 hours, and the child can wear a mask safely, then we follow the yes arrow over to the return to school. And again, these symptoms have to have stayed resolved for 24 hours after they resolved. They have to stay an additional 24 hours. And it's important to note that it is important that the person can wear a mask safely. And we are asking that the person wear the mask when they do return to school for 10 days. Or is that where we're in the 10 days? I think 10 days from symptom onset. So let's say the answer is no, that the symptoms were major that lasted more than 24 hours. The symptoms lasted, or they were minor symptoms and lasted more than 48 hours. Then we're going to go to the no, which they're going to ask, has a PCR test been done? And so, I just want to clarify that it's important that it's an actual PCR test, not an antigen test. And we can get into more of those details later, but it has to be a PCR test. If the answer is yes, just a sec, my chat's covering my screen. If the PCR test it was done, then you get the test results. If they're negative, then you ask the question, can the person wear a mask safely? Again, if they can, then they can return to care once the symptoms have stayed resolved for an additional 24 hours. And we ask them to continue to wear their mask for 10 days following the symptom onset. If there was no PCR test done, the parent chose for whatever reason not to get them tested or wasn't able, or for whatever reason, then you follow it down on the right to home isolation. And that is a 10-day home isolation and 24 hours fever-free without fever-reducing medications. And then if the test results were positive, then we're going to, again, head over to the home isolation for the 10 days. The other way to head over, unfortunately, to the home isolation bubble is if the person cannot wear a mask safely. If they, for some reason, by age or a medical condition or something, are not able to wear a mask safely, then they are in home isolation. And I like this chart because, and I think Jane, you can maybe the next slide, it kind of breaks it down a little easier to see. And then if you go to the second one, these slides don't show it, but again, those symptoms are listed at the bottom, the critical, major, and minor. And let me just make sure I didn't miss anything. And so what we are considering, just as a clarification, is that children age 2 and over are considered an age that is safe to wear a mask. Under the age of 2, the CDC and the American Academy of Pediatrics do not consider that a safe age. So, all right, Jane, if you could change the slides. So we're just going to go through kind of a quick scenario of minor symptoms. So again, a sick person has minor symptoms and they resolve in 24 to 48 hours of onset, and they can wear a mask safely. They can return to care if symptoms stay resolved for 24 hours. No PCR test is required, but they will be out for a total of 3 days. If the sick person has minor symptoms only and symptoms resolve within that 24 to 48 hours, and they cannot wear a mask safely, then they must follow home isolation protocol. All right, Jane. And so this is just a quick of major symptoms. The sick person has major symptoms that resolve within 24 hours of onset. The person can go back to school or work when symptoms stay resolved for additional 24 hours. There's no need for a PCR COVID test to return to work or school. But if the sick person has major symptoms that do not resolve in that 24 hours of onset, a PCR test is required. If the test is negative and they can wear a mask safely, they can return to school or work when symptoms are resolved for an additional 24 hours. So I know that was kind of a quick overview of the chart, but what we have found is that if you take this chart out and you work with it quite a bit, like every day, and run your scenarios through it, it starts to make more and more sense the more you use it. So we really do suggest that you guys try to get comfortable and familiar with this chart so that it gets easier to use. And that's it for me, Jane.
Great. Okay. Sarah, back to Sarah on the contacts tool, which I'll put in chat.
Great, thank you, Jane, and thank you, Kara, for that nice overview of R2. Okay, so the next step is to talk about what happens to the classroom when you have students or staff who have symptoms of COVID. Now, this tool is going to be used very closely with that R2 tool that Kara just went over. So I suggest, you know, as you have your R2 chart printed out and at the ready to decide who has to go home and for how long, that you also have this what happens to the contacts tool also at your side, and that you're looking at them together. And so I'm going to start at the top with this tool. When a student or staff is out of school because of a COVID test or symptoms, do their contacts, meaning their classroom, their cohort, anyone that they come in contact with at school, do they need to be dismissed and quarantined? Okay. And the answer is, if a student or staff was sent home or experienced illness, if they were in the classroom within 48 hours prior to their test or symptom onset, then you need to follow the flow chart below. Now, say you learn about a child who, or a staff who has COVID symptoms, but they haven't been in class for, say, 72 hours, you do not need to pull out this chart because the cohort is not at risk for exposure at that time. So that 48 hours is key. Okay, so the scenario I'm going to use is yes, this student was sent home but with a COVID symptom, and they were in class within that 48-hour period. Okay, so we're going to work our way through this chart. And on another webinar that the education team did, they said it so nicely. This is kind of like a red light, yellow light, green light, traffic light situation. And so we can view it that way. So going into that first box on the left, we have to ask these questions. Does the student or staff sent home have a positive COVID test? Okay, yes or no. Or does the student or staff sent home have new symptoms and they've been in close contact with someone who has COVID-19? Or does the student or staff sent home have new loss of taste or smell? If you answer yes, if any of these answers are yes, their cohort or classroom, their contacts in the center will have to be dismissed immediately, and they will have to complete a full quarantine period based on the last contact with students and staff sent home. Okay, so again, I'll just give you an example. If they have a positive COVID test and they've been in contact with their classroom within that 48 hours, everybody gets quarantined for the 14 days. If they have symptoms of COVID and they have been in close contact with someone who is positive for COVID, we're considering them presumed positive for COVID. And so, yes, the cohort would need to be quarantined. And then the third example, that critical symptom, say a staff member was sent home with new loss of taste or smell, then again, they will need to quarantine that cohort immediately for 14 days. So our red box is our most urgent box and the one that we need to act on the most quickly. Now, when you hit this red box, please contact us at Health ECE COVID, and we will help you with this. We will help talk you through this, and we will provide you with quarantine letters for that cohort. So please reach out as soon as possible if you find yourself in this box. Okay. Now, say if all answers to those questions in that red box are no, then we have to go to our yellow box, our caution box. Okay, and then there's more questions that we ask here. Does the student or staff sent home have one or more major symptoms? So this is where we're really going to have to be discerning and clear about whether this student or staff has major symptoms or minor symptoms. So one or more major symptom, do they have it? Or do they have two or more minor symptoms? Okay, and then the last question really relates to what kind of illness are you seeing in this classroom? And I know many of you have been experiencing large percentage of children out with COVID symptoms recently. So are 10% or more of the students or staff in this classroom or cohort currently out with COVID-19 symptoms? If any of these answers are yes, you are going to go into a 4-day period where you're going to evaluate what's going on, okay? And again, if you find yourself in this area, I urge you to reach out to us and we can help you with this, because this is hard and it's confusing, and we're here to help you with this. So during this 4-day period, what we're doing is monitoring that ill individual to see what happens to them, okay? We're going to look at, have their symptoms stopped? You know, did they last 24 hours? Did they last 48 hours? and did they get tested? Okay, so those are the questions we're going to be asking here. And in those first 4 days, those students can stay in the classroom. They do not have to be quarantined. Okay. So, and when I mentioned, you know, the kind of sister chart that you're going to be using with this particular tool, you're going to pull out that R2 chart again, and you're going to look at it because you're going to need that to determine if that sick person that we're evaluating right now is going to be able to come back to school. Okay. So, so say we're on day 4 and you find out that that person you're monitoring got a negative COVID test, okay? And you go through the R2 chart and you determine, yes, they're safe to come back to school. They got a negative PCR test and they can wear a mask safely, okay? So okay, so let me back up for a second. This is a little bit complicated. We find out this person has a negative COVID test. So that will release people from quarantine. That will release your cohort. And if you had already started in your cohort, but if you're still in day 4, you haven't quarantined yet, if that person you're monitoring got a negative COVID test, that will mean that the cohort doesn't have to quarantine, okay? But say you didn't find out anything about this person until day 5 and you had to start quarantining, okay? That's when you will contact us, or even before that, contact us, and we would still be waiting to see if that ill person was released to come back to school. It's called the criteria for that person to come back to school. They have to meet that before that quarantine is lifted, okay? And I know this is confusing, and because it's talking about both the cohort and that sick person. So I really urge you, if you find yourself in this yellow box, please talk to us and we can help you through it. Because there's three different things that you're gonna have to be concerned about. Now I'm gonna let Kara or Jane intervene here and see if I've left anything out, because this is such an important chart and it's confusing. Do you guys want to add anything here?
I don't have anything to add, Sarah. I think you did a good job.
Okay.
Yeah, likewise. I think it's just people really thinking through it with the examples that they have in their center or the ones that we've given them.
Great. And please, if you have questions about this chart, write them in the chat and we will cover them at the end. Okay, Jane, next slide. Oops. Okay. So just kind of a follow-up to this last chart. Here's some Q&A that we're gonna go over. So if a student or staff has a positive COVID-19 test, what happens to the positive case? So if you have a staff or child who gets a positive COVID test, they're gonna go into home isolation for 10 days. And that's going to be from either when the first symptoms started or the date that the test was done. Then we're going to ask, what happens to the close contacts, the household contacts, the siblings, or the cohort of a positive COVID case? All of those people are going to have to quarantine for 14 days from the last close contact with that positive case. And then what happens if if a household contact is exposed to someone with COVID-19? And I'm going to try to give you an example here, maybe using a mom. So if we have a mom who was exposed at work, but she doesn't have any symptoms, then the child or staff, you know, say it's the staff's roommate who was exposed at work. In either instance, the staff or the child can attend care or go to work. However, and this is really important, if that mom or that roommate of the child or staff becomes symptomatic, then that child or staff needs to stay home from school or work. So it really depends on if they've been exposed and then they develop symptoms. When that happens, that person is considered a presumed positive COVID case, and then all their contacts would need to be quarantined. Now, another tricky situation comes up with say a mom becomes COVID positive or presumed positive, okay, and she lives with her child and they can't separate from one another during the mom's isolation period. It's just impossible. It's a tiny house. They're on top of each other. In that instance, the quarantine period for that child will be longer because the child will be quarantined throughout the mom's 10 days of isolation, and then they need to add another 14 days on top of that, because essentially the quarantine stops when they are no longer exposed to that mom. And her isolation period is for 10 days. After those 10 days, she's not considered contagious. So that's when that 14 days of quarantine would start for that child. And the reason is because, you know, up until that 10th day of the mom in her isolation period, that child could be exposed. And so it takes another 14 days to watch whether that child could develop COVID. So I think it makes for a very long time out of school for that child, but that is the CDC recommendation on quarantine in a household where people can't separate and one person has COVID. Is there another slide, Jane? Okay. Okay, what brings back the person or classroom after close contact with a positive COVID case? Answer to that, 14 days have passed since the student or staff was last at school. Now, what I had just talked about was that could be an extended period if that close contact was a family member in a very tight household. If someone has been exposed to a positive case, a negative PCR does not change the quarantine period, and that is super important. If there's a positive case in a classroom, that quarantine period, 14 days past exposure, and one of those kids or teachers gets a test and it's negative, it doesn't matter. They still have to complete that full quarantine period. Okay, I think the next one. Okay, so I think we're gonna unmute Tori and Jane and Elena, and we're gonna attempt to answer your questions. And they're gonna read out the question, And then Elena, our amazing epidemiologist, is going to assist us in answering these questions.
And I'll just, Tori has been collecting them out of chat and categorizing them. So Tori, I'll let you just get started with what you've found so far.
All right, sounds good. So I have a few that are just grouped them into kind of a general category. Are all schools and childcare centers required to follow this guidance in the state?
Well, I would start by saying that schools, childcare providers, and public health, we all have the shared responsibility to apply this guidance in settings. The guidance was designed to reduce the risk as much as possible to have COVID transmitting within the childcare setting. And this guidance wouldn't be in place if the state didn't believe that there was a large enough risk to public health. So by having this guidance and by following it, we're all kind of doing our part to trying to minimize that transmission. I will say that if the guidance is not followed, then the child care centers are putting themselves at greater risk for an outbreak. And when we do have an outbreak, which the threshold is relatively low, then the entire center, at the worst, can be closed. We're talking all children and all staff for a minimum of 2 weeks, if not longer. So we strongly encourage adherence and compliance with the guidance for the benefit of protecting everyone's health and safety and to help keep operations operational for as much as possible during a pandemic.
Can I add to that one, Elena, as well?
Absolutely.
Yeah, so the governor has determined that childcare is a critical business/service, and all critical businesses and services are required to follow CDPHE guidance. So in effect, it is mandatory for all in the state, all childcare in the state to follow this guidance.
All right. So our next question is wanting to clarify the difference in the 14-day quarantine versus the 10-day isolation.
Absolutely. And this is a common question we get from all sectors, including the general public. It does seem kind of backwards intuitively that we would want to keep healthy individuals away from others longer. But really what this is a reflection of different stages of illness. So if you think about it from the very beginning, if you're exposed to an individual that has COVID and you're feeling healthy, you're in what we consider an incubation period. So what that means is you're healthy, you're in what's commonly understood now as quarantine, and we're waiting to see if you develop illness. And unfortunately with COVID-19, it has a relatively long incubation period. So it means it can take up to 14 days for symptoms to develop. You know, for the majority of people, we do see symptoms develop in under 10 days. And for, the average person, we do see it in about 5 to 6 days. However, it can be up to 14 days. And because individuals can be infected and not know it, we have to make sure that they spend that entirety of that 14-day incubation period while they're feeling healthy away from others to see if they develop illness and to keep them from accidentally spreading it to others while they feel healthy. Now, if you think about that distinction from when you're feeling healthy to when you actually are infected and feeling ill, that's when we start talking about isolation. So you can think about isolation starts with an I and illness starts with an I. So quarantine is for healthy people, 14 days. Isolation is for someone who is ill. Remember, not everyone who's exposed to COVID will develop illness. So once we have determined that someone does have COVID, they are in fact ill, then we're looking at what we call the infectious period. And the infectious period for COVID-19 is believed to be about 10 days. That means that someone who is ill is infected with COVID, we believe that they are at risk of accidentally spreading it to others for about up to 10 days after the illness has developed, either from the time they started developing symptoms or from the time they had their first positive test if they're asymptomatic. So again, these two differing periods refer to different stages of the disease process and refer to distinct populations: healthy exposed individuals or ill people that need to control their ill people that need to be separated from healthy people to prevent the spread of their illness.
Thanks, Elena. All right, we have a question of, would you like us to send home the health check questions with the parents?
Does someone from the ECE team want to talk about just that process? Or
I think that's a
looking at the
great
schools?
idea. I think that would be a great idea to send that home with parents and staff so that they can do their own checking in the morning before they even attempt to come to childcare, to work, or to school.
And absolutely, from a disease control side, we would absolutely encourage individuals to not even leave the house if there is any symptoms, because remember, COVID-19 spreads mainly through respiratory droplets and when you're in close contact with an individual. So the more you can reduce those interpersonal connections, and that means even dropping someone off at school and having a conversation, the more we can reduce those face-to-face contacts, the better job we can do at preventing the spread to others.
And just adding to that too, if they never come to school while they're sick, then we don't have to use that quarantine chart.
Absolutely, absolutely. We have to remember when we're talking about this, what happens to the contacts guidance. This only applies if the individual in question has been in school within 48 hours prior to their positive test or onset. So if we play it safe, we don't even get them in the building like Sarah said, then this cohort exclusion doesn't even become a question.
And I just want to do a time check. We've got a little over 10 minutes left. So Tori, is there some hot items on your list?
Sure.
Isn't this till 6:30, Jane?
6. Oh,
No, 6:30.
6:30. Okay, never mind. We have more time.
Okay.
Good, we need it.
And I was just going to add to that as well. So if a child is kept home with their symptoms, just a reminder to still track that in your illness log, and then keep that on file so that if we did need to ask for the illness logs at some point, you have that documented. All right, there's another question, just a general question about, we get a copy of the hypotheticals that Kara went over? And since this is being recorded and we're planning to send you all the link, you'll get it that way. And we're definitely happy to share those hypotheticals.
We are creating a kind of a frequently asked questions with all of these questions that you're asking today.
All right, so some questions related to symptoms. How do we identify if an infant through toddler has a loss of taste or smell?
That's a really good question. Now, there's definitely some limitations to this. Keep in mind that this guidance is designed for use all the way up through K through 12. And what we do know is that clinically, we have some tools available to help identify essentially olfactory disorders and identify or can reliably test the sense of smell in children as young as 4 years old. Keep in mind that these are typically used in clinical situations, and most are used for, again, those about 4 and over. With infants and young children, it may not be possible. So there are some things that we can keep an eye out for. And of course, a lot of these are dependent, though, on the child's ability to be able to self-report and communicate to the individuals around them. So that is still a limitation even with these. But I would say some questions to ask. Was the child unable to taste or smell something that others in the room were able to perceive? Keep in mind that loss of smell can affect the loss of taste. So can't speak for all children, but if some children are not able to taste things, or things are tasting funny and it's just really, really uncommon, then maybe we would look for that as a sign to follow up with your provider and see if they can do some additional follow-up to be able to determine if there truly is, an olfactory or taste disorder that's currently happening with the situation. But yes, in short, it would be very difficult for infants and those that are very young and are not able to communicate with others to be able to detect that.
Thanks, Alana. So someone is wanting a little clarity around the 24 hours and then another 24 hours. So like, what is the total hours to exclude with a minor symptom?
So are we referring to the return to learn guidance where we're asking if symptoms have resolved for within 24 hours of onset?
Yes.
Okay. So with that tool, we are looking for symptom resolution, we said within 24 hours of onset, and then we need to make sure that the symptoms do not come back for an additional 24 hours. So what that means is, runny nose starts on a Monday, or Monday morning, it's gone by Monday night, and then we want to make sure that the child is still home on Tuesday and that the runny nose does not come back. And that's important because symptoms in many illnesses, but also COVID-19, can ebb and flow. It's not always a trajectory of, they get worse and then they keep getting worse. They can get worse, then get better. You can have some symptoms start later in the course of illness than others. So we want to make sure that they have resolved and they've stayed resolved.
All right, another return to learn question. So if there's a negative PCR test, but symptoms haven't resolved, like a lingering cough, do they have to isolate for 10 days?
Give me just one moment. I just want to scan between all three of these levels to make sure that my response is consistent. Okay, so really what we're getting at is just our typical isolation information. And this is what we share both outside of ECE settings with individuals as well. Really what we want to see is that symptoms are on a trajectory of improvement. So we want to see that by the end of the 10-day isolation period, symptoms have improved. They do not need to have fully resolved, but we want to see a significant enough improvement to see that that individual is on a forward trajectory for improvement. We'll say that there is one exception, and it comes back to loss of taste or smell. We do find some early evidence that loss of taste or smell can persist in some individuals for a matter of weeks. So let's say that there was an individual and loss of taste or smell was one of their symptoms, and all the other symptoms were improving except for that one. That's okay. They could still return as long as all the other symptoms have been improving.
All right, a question, is there statistics for children who are positive with COVID with only the minor symptom of runny nose?
That's an excellent question. And like a lot of epidemiology, I say that unfortunately we don't quite know yet about COVID. There is, I would say, probably a bias when it comes to testing. So we know that that young individuals do seem to be less likely to have severe disease. They may be more likely to have mild illness and or be asymptomatic. And you can think that because of that, they may also be less likely to get tested. And so without that really comprehensive testing data to know what COVID looks like in all children, it's really hard to put a statistic to that and say how likely or how many children have COVID but only have those minor symptoms. What we can say, though, among the data that we have on known cases, we do see a higher frequency of mild symptoms like runny nose rather than more severe symptoms like cough and fever. So I understand that it has to be incredibly frustrating to have the idea of keeping a kid home with a runny nose for 10 days. And yes, there is a chance that they don't have COVID, but there is the chance that they do, and that runny nose is that only symptom. So we have to err on that side of caution, and we have to treat every individual who is unfortunately not able to meet the return to learn guidance as someone who potentially could have COVID, that we have to keep out of the program to prevent them from accidentally spreading it to others.
All right, we have a couple questions. They're asking about a negative PCR test and whether they have to be out for 10 days regardless. And then, you know, if they had a alternate diagnosis from a pediatrician, and then also the scenario of a child being under 2 or unable to wear a mask. So maybe reviewing what happens when there is a negative test.
Okay, so the return to learn guidance does differ depending on the current stage where Boulder County's dial is set. And currently we are at Safer at Home level 2, which was shared earlier. And the alternative diagnosis comes into play with when we are in Protect Our Neighbors, as well as Safer at Home level 3. So I'm not going to speak to that one too specifically because again, it depends on what level we're in. And then that is when the return to learn guidance that you're looking at is effective. Although I will say that across all of the levels, yes, there certainly is a strong likelihood that if the individual is not able to wear a mask safely and but they do have a negative PCR test, but that individual may still have to stay home for a 10-day isolation period, you know, again, given the criteria in the return to learn guidance. Again, I understand and I recognize that that has, you know, financial and potentially, you know, economic tolls on both the centers and individuals, but we have to just continue to remember that that negative test can help the cohort return to class. And while it might be extremely difficult for individuals and a family to keep a child home for 10 days with that negative test, it allows the cohort to return. And as we're entering in, you know, cold and flu season, we're gonna have to assume that every individual at some point or another has a good chance of being in that position, of being that one person who's out for 10 days. And so by still getting that test, even though if it doesn't allow you to return, can allow your cohort to possibly continue learning. And then when it happens with another child, it might put you in the position of being able to return as opposed to having to stay up for a full 14 days because your colleague or your classmate didn't get a test.
Right.
Hi, sorry, this is Carrie from Floor, and I'm wondering if I can ask for a little bit of clarification on the return to learn question that I had with the lingering cough, or like if somebody had a runny nose. Would that be okay right
Sure.
now, or do you need to
Sure,
come back to it?
yeah, I'm happy to make sure that I understand your question.
Okay, so if somebody has a lingering cough and their symptoms haven't gone away, then they do have to stay home for that full 10 days, even if they have a negative COVID test. Is that correct?
Okay, so what you're really talking about is the cough is the primary symptom and it truly has not improved whatsoever. Is that what you're asking about? Or?
Yeah, let's say it's a cough that has improved slightly, but they still have a cough and it's been like 5 or 6 days or something like that, and they get a negative COVID test. Can they come back to school at that point?
So under Safe at Home level 1 or 2 with a negative result, if they are, I'm going to pause, sorry. we want to be able to answer all of the hypothetical questions, but please bear with us because there are these, as you know, the multiple criteria. So just give me a moment to look through the flow chart and make sure that I'm not going to backtrack. So as a cough, PCR is negative. One of the big deciding factors is going to be their ability to wear their mask safely. And if that's a no, then it is following home isolation for the full 10 days and making sure that, again, they're fever-free for 24 hours and that there's at least some improvement for the cough before they return.
Okay, so I'm thinking of like the runny noses and coughs that can last for weeks and weeks. Like, is that person going to have to be out for 10 days, or could they return if it seems like it's improving after like 5 or 6 days?
Again, we have to take all those different factors in the flow chart into consideration.
Okay.
But for anyone who does find themselves in that red home isolation bucket at the end of the flow charts, then again, the only criteria there is that after 10 days isolation has passed, there has been some improvement. And to be honest, if they have a lingering cough or some other symptom and there's been no improvement after 10 days, I mean, we would recommend, I think, anybody across the board that they would, seek some clinical evaluation regardless.
Okay, yeah, I guess I'm just thinking like if they get the negative PCR test and they haven't gotten to 10 days yet, but it seems like their symptoms are getting a little bit better, like a runny nose that it's been like 4 days or something, or 5 days, they get a negative PCR test, but the runny nose is still going. I'm just wondering at that point.
So,
and can I just intervene? Because I think there's probably a lot of questions similar to that.
I'm sorry. Yeah.
And I bet you'll get your answer. And I know there's a ton of those hypothetical even in chat. And we're trying to get through all of them. So if that's okay, Carrie, I'm just going to let Elena go on with one of the other ones.
Yeah, no problem. Thanks.
Thank you.
All right, so some of the other questions I grouped together are in regards to wearing a mask. And I guess one of the kind of most basic questions is, can a 2-year-old wear a mask safely?
I'd like to ask someone from the ECE team to possibly reiterate what we did about the CDC and American Academy of Pediatrics guidelines. Is that okay?
Yes, of course. The CDC says that children 2 and over can wear a mask safely. However, there also may be children who have a medical reason or a disability that prevents them from wearing a mask safely. So those are the 3 things: age, medical condition, or disability that you would look at to see if a child can wear a mask safely.
And then to follow up with that, Sarah, someone asked the question, would a child who is medically exempt from wearing a mask have to be excluded for 10 days? Or could they attend without a mask, but having passed all other criteria?
So I would, I guess, recommend that if that situation were to come up, that they would reach out to the ECE team and that we could follow up and take that on a case-by-case basis. Unfortunately, when you start tiptoeing into, legal territory, very hesitant to make any kind of broad disclosures across the board.
So question about an infant. So does that mean that an infant or 1-year-old who cannot safely wear a mask must isolate for 10 days?
If the individual cannot wear a mask due to age or medical condition, according to this guidance, then they would default to following home isolation for 10 days, with the exception being if by following return to learn, they had symptom resolution that allows them to continue following or returning to school per regular illness policies.
There's a question regarding advice from a pediatrician differing from this guidance. And I think this might have come up at the meeting earlier this week. Any guidance around that, or is there any sort of communication happening with the medical community on this guidance.
Let me just make sure that I'm fully understand the question. So is the question basically insinuating that they have experience with clinicians who are providing direction or recommendations that are in contrast to what we're presenting? Or was there a specific situation that needs to be addressed?
Yeah, so the question was a pediatrician that said an infant or 1-year-old can return to school without a mask.
Okay. So in our response, we do encounter clinicians that will often provide recommendations that are in contrast with what Boulder County Public Health is following. Keep in mind, what Boulder County Public Health is following is the statewide guidance. CDPHE does disseminate this guidance to clinicians, and when there are updates to the guidance, they also provide alerts to let the clinicians know what the most up-to-date recommendations are. Now, in practice, clinicians obviously have a lot on their hands. Their focus is working on the individual patients. The vast majority of them don't work simultaneously in public health and work with the guidance on a day-to-day basis. So there is room for error, and we understand that it can be quite confusing when a clinician is providing information that is not in alignment with the guidance. At the end of the day, public health's focus is preventing disease in the population. So a clinician focusing on an individual may give a statement like you shared that might be differing with the guidance, but we're going to have to default to the guidance when we are considering allowing that individual to return to a group setting and potentially putting others at risk. So we try to encourage our local clinicians and healthcare providers to stay up on the guidance as much as possible. But as you can see firsthand, it is complex, it's complicated, and there is certainly room for error. So at the end of the day, we're going to have to default on what's going to keep the population safe, and that's this guidance.
Jean, do you want to go through some of the questions that have come in while?
Certainly. There was a number of people that were asking about the 2-year-old versus 3-year-old wearing masks, if we are still in Boulder County recommending 3 and over. And I think that may have been covered to some extent, 2-year-old versus 3-year-old, and how long they need to wear a mask after they return.
I can answer the one about how long they have to wear a mask after they return. So after they've, for example, gotten their negative test result and they can wear a mask safely, it's recommended that they wear that mask for 10 days since symptom onset.
There were some questions around parenting, parents being upset, losing staff, losing families enrollment, and if all of those things were taken into consideration. I did mention in chat that there is a QR code on each of the tools to give feedback. Sarah, do you want to add anything to that?
Yeah, we would really urge you to provide feedback on this guidance. If you can be as specific as possible about what you would like changed about the guidance and the reasons for that. CDPHE is going to be looking at all those comments, and the next iteration of tools will be based a lot on those comments, as well as emerging guidance that CDPHE learns.
Absolutely. And if I can just echo what Sarah said, the guidance has changed and it will continue to change as we learn more and more about COVID. So the more that we learn about COVID over time and the stronger evidence that we're able to acquire about how it's transmitted, the settings that put individuals at higher risk for transmission, the more the state will be able to refine the guidance to be the least restrictive guidance as possible while still preventing disease transmission. So we understand that we've been in the situation for over 6 months now, but we're still, in terms of a pandemic of a novel pathogen, in really early stages of understanding about COVID and the risks involved. So I know that 6 months doesn't seem like a short period of time for individuals that are living it day to day, but I can assure you that at the local level, the state level, and the national level, we are trying to learn as much about this illness as possible, or this disease as possible, and figure out how we can restrict people's day-to-day activities as little as possible while still protecting others. So I am optimistic that the more that we can learn, the more that we can continue to modify the guidance and adapt it over time.
Thank you, Elena. There's some questions about testing. Why is the antibody test not approved? And will the free testing sites remain open in Boulder?
Sure. So I'm sorry, was the question why has antibody testing not improved, or why is it not being taken into consideration in the guidance?
Why, yes, that last, why is
Okay.
it not being considered? Why is
Okay. So just like diagnostic testing, antibody testing is also complicated and also very new with COVID-19. So there are different types of antibody tests that detect different types of antibodies. And without boring you all to death about the biology of it, different antibodies can become detectable at different stages of disease. So some of the antibody tests look for what we call IgG antibodies, which kind of rise later in the disease course and can kind of be detected, months after you've been infected. So if someone were to test positive on an antibody test that detects IgG, well, you might end up isolating in an individual who's actually already recovered from the illness weeks or months in advance. On the flip side, there are some tests that can detect other types of antibodies that are apparent in acute infection, but I'm not seeing those tests used as widespread as some of the IgG or even the total antibody ones. So at the end of the day, CDPHE is focusing on the diagnostic tests that are have the greatest ability to detect acute infection, while ruling out some of those other type of tests that the results may or may not be as actionable or informative.
Thank you, Elena. Does Sarah or anyone know if the free testing sites in Boulder are still open?
Yes, I know that the site at Stasio is open until October 18th. Unfortunately, the walk-up site on the hill is now closed.
And we would encourage everyone to defer to our webpage for up-to-date information on testing resources in the community.
Does either of you know when or if these tools will be translated into Spanish and other languages?
Oh, that's an excellent question. And I don't.
I don't either.
I don't, but that is the absolute, the kind of very specific feedback we would love to encourage everyone to submit to CDPHE.
There was a question regarding use of masks during napping and eating, and I may be translating this incorrectly, but they're asking about best practice with the child wearing a mask safely while napping and eating at school when the mask is removed.
So I would say that, we can't expect an individual to safely nap and logistically eat with a mask on their face. And so in those situations, if an individual has returned because they've followed Return to Learn and they've answered yes to wear a mask safely, personally, I would believe it's okay to remove them for those specific activities, along with everyone else in the class who would be removing them for those activities alone. Would ECE agree?
Yes, it's prohibited to leave a mask on a napping child due to the unsafe nature of that activity.
So really what that question is looking for, can a person wear a mask safely? It's during the remaining moments throughout the day when it is safe to keep that mask on.
And there's a couple hypotheticals that now I think we could spend a little time on, if you're okay with that, Elena. they were touched on when we went through these tools, but if one child stays home with symptoms that last more than 48 hours but chooses not to get tested, the class or cohort is required to quarantine starting at day 5. I wanted to confirm that.
Okay, so again, just asking for a moment because we've got to look through these. So I'm going to defer to the safer at home level 1 or 2 since we're currently in level 2. So if an individual had symptoms that did not resolve in 48 hours, again, we have to keep in mind that this, because of what happens to the contacts, if someone has loss of taste or smell, that's sending everyone home for 14 days no matter what. If they have new symptoms and had close contact and it's somehow still been at school, even though they had close contact, that's going to send everyone home for 14 days no matter what. If those criteria in the red box have not been met and we're solely focusing on the yellow box, so we're talking about maybe 1 or more major symptoms or 2 or more minor symptoms or a combination of the 2, had not resolved in 48 hours, then we would continue to defer back to the return to learn guidance. So the individual themselves may not be able to return until a full 10-day isolation period is met, but in some of these situations, if they get tested and get a negative result, it may allow the cohort to return sooner, even if the individual isn't.
So no question is quite as simple as it sounds, right?
Absolutely.
There was a question that we didn't touch on, but we have experienced. If a child tests positive, then returns after their isolation, how do we follow illness guidelines, and is additional testing not recommended?
Okay, so let me make sure that I'm understanding this. So we're asking about an individual who's tested positive for COVID and has completed their full 10-day isolation period. What needs to happen then? Is that the question?
Yes, that's right.
Well, assuming that we have not detected evidence of an outbreak in the facility, that this is an isolated individual, there's not ongoing transmission in the facility, then really we've met that return to work guidance and the individual can return. I don't want to say no questions asked, but as long as their symptoms have been generally improving, they've been fever-free, they can come back. We do not recommend retesting after an individual is tested positive. There are a couple of reasons for this. One, individuals can still have some remnants of COVID-19 detected, even when they're no longer infectious. So if you think about a positive test, it's almost picking up footprints of COVID-19. So when someone is infectious, there are going to be a lot more footprints and the test is going to be really better positioned to detect them as positive. And even though over time they may no longer be infectious, some of those essentially footprints might still persist. So somebody may no longer have the ability to infect others, but can still have COVID-19 detectable on PCR results. So because of that, we follow the CDC guidance, and that's also what is followed by the state overall, saying that we follow a resolution of symptom-based discontinuation for isolation rather than a test-based one. If we did test-based, we might have individuals continue to test positive for weeks after they're no longer infectious, possibly keeping people out of school and work for longer than what's needed.
And if that same positive case does months later start symptoms again, would we go through an isolation or quarantine?
Okay, so this, kind of like many things, this question can get complicated. However, we would say that if they are symptomatic, again, down the road, we still would want to return and do the normal COVID evaluation, follow the guidance. There is an exception, and I won't get too deep into this because it hasn't come up too frequently yet, but there are some exceptions with individuals that have recovered and have evidence of recovery on PCR that may not need to quarantine moving forward. But that's something that, again, is still relatively new and hasn't come up too much. So end of the day, just if individuals who've recovered from COVID have new symptoms down the road, general recommendation to get evaluated by a clinician and follow our COVID guidance.
Thank you. This is a really clever question. If we are quarantining a class and there's new enrollment, so not the children that are quarantined, but new enrollment, can we enroll them? Can we open it to new children?
So this is where I might ask for some help from others, because my default would be, from a disease control standpoint, if they did not have that exposure, or if you even had kids that were not in the program, the week that the identified exposure occurred, from a disease control standpoint, they do not have to quarantine. But in actuality, we would likely have the staff members quarantined as well. So theoretically, if additional staff is available who had not been exposed and not been quarantined, there's nothing stopping the other kids that were not present on the dates of identified exposure from coming in. But we haven't really seen that happen too much in practice, because staff has typically been quarantined as well.
And we would assume a deep clean in between there.
Oh, of course.
Yes. So a question about masking outside. Are children allowed to have a mask break while they're outside?
So I would stick with the language of mask wearing is strongly encouraged. We do believe that the risk for transmission is heightened indoors, particularly in settings where there's poor ventilation. I think by default, public health would probably not ever encourage individuals, not to wear a mask aside from those safety settings. So we're certainly not going to encourage anyone to, take masks off and run around outside. But it is probably a lower risk setting. And if they're outdoors, if there are substantial distance between individuals, that is probably a safer situation than removing the masks indoors in close proximity to others.
There was a question about a letter, if BCPH would be willing to write maybe a general letter that would go with the home exclusion tool to encourage or set the tone that this is coming from BCPH or public health rather than the child care program.
Okay, can I ask a follow-up question? Are we talking about essentially individuals that have not met the return to learn criteria versus like a classroom that we've quarantined?
No, I believe this is around just a general communication with the home screening tool, that a letter that we would write in support of the conditions, the symptoms, and so forth.
So we haven't done them in the past, but I do think that's a fair request. And if we're asking for your cooperation to this guidance, I would absolutely be open to discussing this with the team and trying to determine, what kind of communications we can help provide to help encourage compliance. So absolutely, in that kind of situation, would we just ask them to follow up with your team, Sarah, and kind of take it individually from there, or?
Yes, that would be great.
Okay.
We'd be happy to draft that.
Yeah, we really are here to work with all of you. So
yeah,
thank you.
And I think we covered all that I can see. Tori, anything else you noticed?
No, I don't think so. I was going to add, if a letter like that does get drafted, it might be helpful to include the link to have parents submit feedback to CDPHE on the tools as well.
Yeah, that's a good idea. And there's, Tori also put in the chat the Boulder County COVID testing information and the link that you can give feedback on, in addition to those QR codes on each of the tools. So we encourage you to do that, to give that feedback. And we do have a couple minutes. If someone would.
Jane, I was wondering if
Please.
we could speak a little bit about what is requested from a child care center if there is a positive child or staff or exposure in the classroom. so that centers can prepare themselves of what they may have to submit, so that we can get that information quickly and that it's all correct, so that we can move through it and getting it to Elena to evaluate. So I don't know if Elena, you want to speak to that?
Sure, I'd love to. So when we do have a potential exposure concern, so this can be an individual who has confirmed COVID or COVID-like symptoms, and there's enough widespread illness that we would consider perhaps doing a tentative quarantine in the classroom, or definite quarantine if it is a confirmed case or someone has a loss of taste or smell. Then we do follow up with our routine public health disease control activities, and these are required by law. Some examples of this includes interviewing the case to identify, when symptoms started, and try to figure out maybe when they were in classrooms. This can be facilitated by the programs keeping attendance logs, sharing those with us, as well as those illness logs, so we can get a preliminary sense of perhaps when they first start developing symptoms. Remember, that symptom onset is key, because we need to identify, were they in certain cohorts or classes within 48 hours before symptom onset, and being able to narrow down that window when exposure to others potentially happened. The more documentation we have around illness onset, the better job we can do at identifying that 48-hour or minimum 48-hour window. When we don't have a whole lot of documentation, when we're not able to really engage that individual or legal guardian in an interview, we're going to have to err on the side of caution and expand that window, which possibly means quarantining more individuals than is necessary. Another necessary disease control activity that we're required to do by law is contact identification and follow-up. And that's so we can notify those that have been exposed to COVID-19 or other reportable infectious diseases that they have been exposed, and then provide quarantine guidance as well as testing and general support. And when we do that exposure notification, we do not disclose the name or other identifying information of the individual who tested positive. So the way that schools and care programs help us out is by providing rosters of who was present in a specified cohort during those dates that we're able to identify as the exposure window. And then we can draft an exposure notification letter for the care program to send out to the families as well. So again, case interviews and our contact follow-up is required by law no matter what, but the more information that the schools can provide to us help us get a more specified view at what's actually happening, so that the quarantines, the closures can be as limited as possible to just the minimum degree that's needed for disease control. So in short, we're going to be looking for rosters of who has been in a class. We would like to know what dates they've been in there, and depending on the flow of information, I might be able to come back and say, these are the dates we're looking at. In other situations, we might have to ask who was here between this period. So we're looking for names, date of birth, parental contact information. And again, all of this information is allowed to be shared between care programs, schools, and public health due to Colorado statutes. And that's all on CDPHE's guidelines. So if you have any questions, you can send a link and it shows you all of the legal allowances for us to exchange that information. And then also the illness logs. So again, I can understand the temptation as to why people may not want to be forthcoming about a lot of runny noses, especially when, runny noses seem to be the norm in a lot of, young children. However, the more transparent programs can be about symptom and illness circulating in the class, the better idea we can have about the risk. And believe it or not, more transparency about the illness that's happening can sometimes allow us to require less restrictive recommendations. If we truly feel like we do not know what's happening in terms of transmission, and there is an unknown degree of possible COVID transmission happening in the center, that's when we have to err on the side of more extensive recommendations for closures.
Great. Thank you, Elena. And we are out of time. This time is really for real. So I want to just say thank you for everyone for coming. Please continue to use our Healthy CE COVID email. And there are a couple questions that we didn't get to that we will save chat and put together some questions and answers and possibly even answer them in our Monday call. So thank you. And Tori, if you'd stop the recording now, I'll say goodnight to everyone. Thank you.
Okay.
Thank you, Jane.